For those of you who have been participating throughout the week, you know that we've had 4 town halls so far. Well, 3 town halls plus a general session on Monday, in place of having our Family Empowerment Day that we usually have every year. It's been an experience. It's been actually really helpful to learn that some of the silver lining of COVID is that we have the opportunity to reach out to more people, to have access to more people, to have more flexible schedules, to be able to have commissioners and legislators who might not have been able to join if we had it on one day in a couple of hours time. We don't have to worry about snowstorms. We don't have to worry so much about pandemics. We still have to worry about pandemics, but not for the purposes of the Zoom. So we're really pleased to be able to have, this is one of our biggest and most important topics. As everybody knows, Families Together started by family members whose children were in the behavioral health system and were feeling as if the system wasn't being responsive to their needs or even really understanding what their needs were. It didn't take us long to figure out that we aren't just families of kids with behavioral health needs. We're families of kids, and our families have multiple needs and have involvement in multiple systems. We were very, very fortunate that the Office of Mental Health recognized that we were families, whole families with whole needs, and that the mental health, not mental illness, but the mental health of our families was what was really important to invest in, empowerment, in organizing. And so over the past 25 years, we've had tremendous support from the Office of Mental Health, and they've been a leader in helping demonstrate why it's important to include stakeholders in everything that we do and policies that we do. And the whole nothing about us without us really started with that philosophy and has spread to other agencies. We're glad to share it because it means that more people are getting it, right? They're getting the idea that input from stakeholders will result in better outcomes. And we've had a real ally in our commissioner at the Office of Mental Health, Commissioner Sullivan, who has always understood the importance of including stakeholder input in every step of the way, whether it's in policy shaping, whether it's in regulations, whether it's in the actual care, making sure that the system of care incorporates family and youth partnership at every level. And so we've had the good fortune of having Commissioner Sullivan as our friend and ally. And she also, for those of you who have been to our in-person Family Empowerment Days, always comes and represents our group or presents to our group and represents the Office of Mental Health in such a great way. And so I just want to welcome Commissioner Sullivan to say a few words and to address our group.
Thank you so much, Paige. And thank you so much for everything that you do and for everything that all of you out there do each and every day. I don't think any of us expected to have the year we've had with COVID. It's been incredible, unbelievable, painful in many ways, but I think in many ways things are getting better. But I can't thank you enough. You stayed there, you helped, you were there on the front lines no matter what came up, and you were there for our families and our youth. And that's not easy. It's not easy in crisis times like this. So thank you so much for what you've done. I always say this, but you're true healthcare heroes. You've done just a tremendous job. I know we're not over it yet, and there's still a lot to do, but thank you. I can't express that enough. I want to just give you a few highlights of some of the things that we're doing this year. And again, as Paige said, your input, your feedback is so, so important. The other thing that's really important is your voice at meetings like this, and your voice to us in government, and your voice to legislators, and your voice to the governor. You really are heard. I just want to emphasize that. So please keep bringing your voice forward. It's important, and people, and certainly we listen, but I also know that everyone in government listens as well. So thank you. So a couple of things. First of all, in the budget, there is a reference to crisis centers. And I just want to clarify that these crisis centers are really there to build out the whole crisis continuum that we have in the state. And we have a lot of mobile crisis services. We still need to shore that up a little bit more. But we haven't really had crisis centers. And crisis centers across the country are very effective in giving immediate assistance to people who need it. And the crisis centers that we're going to be developing will serve adults, will serve families, will serve children, and will serve an integrated mental health and substance use for everyone who comes to the door. What they allow is that someone who's experiencing a crisis to get immediate help, immediate counseling, Further assistance if necessary. It may involve referral to ongoing treatment. Maybe it doesn't. Maybe the crisis can be resolved right there at the moment. But if it can't be, then there's going to be the ability to have successful referrals, to work with families, to work with youth, and to make sure that that crisis is successfully resolved. You'll be able to walk in if you want to. You'll be able to be referred. Families can bring family members. And basically, it'll be a warm, welcoming environment. We also already have a couple. There's one on Long Island, which is called the Dash Center, which serves lots of families on Long Island. We have one up in Franklin County, and then we have one, I think it's primarily, no, adults and kids too, in the Dutchess County. So, but we're going to be expanding that, making sure that there's enough services available and kind of expanding it throughout the state. There'll be different models, and we need your input on this. But please know that I think this is going to help expand. And the reason why is it so important? Well, it's always important to have crisis centers, but it's particularly important because as of July of next year, that number 988 will become viable. And 988 is a crisis number. It's going to be national. It's going to be national like 911 is for an emergency. But 988 will be the number to call if you're having a mental health crisis. And I think that's going to really transform the system. That's going to enable people to have one number in their mind that they can call. Because even though we have lots of crisis centers, you know, which number do I call? How do I find out? You got to go to a website. It's not quite out there in a way that families can just say, oh my gosh, I need something now. What do I do? You call 988. So that'll be available as of, hopefully as of July of next year, when it becomes a national number. And we need that crisis service to support that. And the crisis centers are a big piece of that. So that's one thing that we're looking at, and we need your input and your guidance as to how to make it really welcoming and effective for families and youth. Another thing that we're going to be expanding are something called youth ACT teams. And ACT teams, it's going to be different than the adult model, but the concept is that it's a kind of treatment team that includes, it can include social workers, it includes peers, and it includes family advocates. It also includes psychiatric help, and it includes nursing. And these teams would serve like 36 families over a period of time for as long as the family needed it. Usually they last about a year, but you know, it could be shorter, it could be longer. But these teams would be available in the community. So they would be there to be mobile, to be out with the family, where the family needs the help. You don't have to go to a clinic. You wouldn't have to, if that was a burden to the family. And they provide intensive support. We've got two up, two in the city. By the end of the year, we're going to be adding another one on Long Island. And then hopefully by the end of this year, early next year, another 5 or 6 across New York State, going upstate. And I think that this is a continuation of our plan to get more and more services in the communities, services that families need. And again, we need your feedback. We can show you how we're planning with this and what it will look like, but peer and family advocate support is a critical piece. So just to highlight those two. Now, the other thing in the budget, which is exciting, is there's $10 million that's going to move from last year to this year. And I think the $10 million for next year is there too, to work with schools across the state, with school districts, together to work from the school districts, how they can work better with mental health providers and with you, with peers and with family advocates. They will be submitting RFPs, in quotes, like proposals for how to enhance their connection to community services. Also, perhaps at times to establish school-based clinics, perhaps to include training and other work that would be linked to the mental health curriculum, which is going on in the schools. But this is really great. I mean, it really offers the opportunity for SED to work with us, with the counties, with the community providers, to really shore up that connection between schools and communities and mental health services. You know, it's amazing sometimes, and whether it's at school or sometimes it's community centers or centers for the elderly, we talk with them and they don't know what's really out there in the community. And we have this whole network sometimes of services available, but people don't know how to access them. And this gives us about $10 million to spread across the state to school districts. They're picking out the school districts in the highest need, and we're working with SED. And I think that's very exciting. It will add to lots of the other services we have in the schools. And just to kind of, I keep asking for these numbers, I get them all the time. We have 910 school-based clinics now in New York State, which is really cool. A few years ago, we had under 200. So now we've got 910, and we're continuing to work with any school center that wants to set those up. And we've been successful in making a lot of them work really kind of pretty well overall. Just a couple other points. I think you're probably aware that OMH and OASAS our plan in the budget is for the integration of OMH and OASAS. And I think there's a lot of positives with this. But one of the big positives, I think, will be us joining together in a major effort in prevention and a major effort on strengthening youth services and services for families. So I think that's going to be a highlight of what we're doing. There's lots of other stuff that goes on too when you pull two agencies and you ask them to work more closely together. But I think it will really integrate care. Like I said, the crisis centers, will serve both substance use and mental health. And we're going to be pushing and pushing so that all our services can do that, can have that integrated open door. And if any of you are used to the CC, Community Certified Community Behavioral Health Centers, those I do that now. They're really doing intensive integration. We're going to be doing more of that. So I think that's another kind of exciting proposal. We have lots of input from stakeholders. Paige has given us input already, and we were looking for more input from all of you in the design of the agency. And I think that's something that's going to happen, slowly over time. It's not going to be boom one day, because we need input from stakeholders as to how to make both agencies stronger and better and more responsive to you and to the families and the youth out there. I mean, that came clearly through in the stakeholder meetings, that we have to be more responsive, and we're going to be working very closely on that. And then just to close, I know there's a little bad news in the budget, but hopefully it can change about the 5% reduction to state aid. And I hope, and we hope that if we get a robust dollar amount from the feds to help us out of this pandemic, that can be reversed. But so fingers crossed, we need your advocacy to push for that. We're hopeful that will happen, but this is a tough budget year, and right now it stands unless we get enough dollars. But please know that including that 5%, whatever that might mean, in terms of mental health support for the services, we're there, okay? So the 5% cut hopefully will go away. Also to know that the CFTSS services, Children's Family Services, now peer and family advocacy, remember, can be billed to Medicaid, but we're not going to reduce any of our support, except maybe that 5%, depending on how that goes, to all of you. But it will enable us to really expand the services if we get used to billing for them in the system of care, because that's one of the best ways to make something ultimately sustainable, is to have a good, strong billing background. So just to be clear about that, and I know that that's of concern to everybody, it's a concern to us, and it's certainly a concern to the governor too. That is there any way we can get these, not have that cut? And that will depend on the federal aid coming through, which we're still hopeful for. So I don't know, I don't want to talk too long, so I think I'll stop there. But just one more time, say thank you again for everything you've done. And I know we've still got some more time at this pandemic, but gosh, you've just been terrific. So thank you for all your time. Okay, so Paige.
Thank you, Commissioner. Thank you so much. I should have mentioned that we have two senators that are going to be joining us at 3 o'clock. I saw Senator Harckham pop in, but oh, there he is. Senator, how are you? Can you, you're on mute, but it's perfect timing, because I was just saying that I wanted to be able to have the opportunity to explain how these forums are working. And we have Senator Brooke is going to be joining us in a second as well. But I just wanted to say, to follow up, Commissioner, to your remarks, thank you very much. Two things that I think you've heard from us already, but I just want to reiterate, and then throughout the next half hour, you'll hear from through the questions that'll be asked of the senators and you, Commissioner. You'll hear more about some things like the cuts. But one of the things that is really important to families has been the that, I talked about the silver lining of COVID. One of the things that we learned is that telehealth can be an effective and efficient way to provide services, including and especially family peer support and youth peer support. There are a lot of reasons why some people choose that method and prefer that method. It's not for everybody, but what we hope is that beyond the pandemic, that family peer support and youth peer support via telehealth will continue to be supported and recognized as the valuable service that it is, and continue to give us the opportunity for to choose that if that's what the family wants.
Yes, and we're definitely supporting that. And what we're trying to, and I know everything isn't finalized yet, but what we've been pushing for is to have everything that's currently billable through Medicaid is going to be billable through telehealth and telesupport. And that includes peer services. So I think that, yes, if we can continue to, I don't think there's been much pushback on that. I think there's a good chance that that will happen, and we definitely support that. It's critical. There's no way that we can kind of expand the kind of work that you've been doing without having you be partners in doing the telehealth as well. So yes, that's very important, and we're working very hard to make sure that that and everything else that we're doing, we're looking at the regs, we're trying to make sure we include everything that could be included in making sure it goes through telehealth.
Great, thank you. I wanted to just turn it over to Brad Hansen, our Director of Public Policy, for one quick question, if you don't mind, Brad.
Hi, Commissioner. Oh, and my cat is an active participant in their town hall today, so I apologize for that. Yeah, she likes to have her voice heard. So our question, and I think you spoke to this a little bit, but is all about, crisis stabilization in these crisis stabilization centers. And a big concern for us in our network, because this is how you frame them as sort of an urgent care for mental health is a very much needed thing in our communities. But we'd like to know, sometimes children and families get kind of lost in the overall mix. And so we want to make sure and hear from you, maybe if you can offer some assurances of how those centers will do to ensure that children and families are appropriate for those settings, that their needs are being met. And also maybe, do we plan on having family and youth peers involved in that kind of response? So we'd love to hear a little bit more from you on that.
Yeah, no, absolutely. In fact, it's going to be, the way we're thinking of planning it is that there'll be separate space and separate entrances and services for youth and families. Because I think if you mix it all up, it just doesn't work. And I think that so that will be there, and specialized staff who know how to work with families and youth. So that's part one. Yes, absolutely. I'm sorry if I got to say that, but a critical part of this will be peer and family advocates. So they will be part of those centers. Centers will be required to have that as part of their staffing. So if the centers that are up now and centers we've looked at in other states have very welcoming areas for families and youth that are separate for adults, and that those areas are staffed by people with expertise in crisis work with families, and peers and advocates are a critical part of that. So yes, that will be a part of the way that they are designed, just to ensure. And everyone will be required to have that if we're going to license them. So it's not going to be like, well, I just opt to do adult. They will have to include the family and youth part of it in order to do it, because otherwise you can't be a real crisis center. I mean, you just can't be. So basically, yes. And we're going to be working with you guys. We'll work with you on how to make sure that they are as welcoming and they provide the continuum of services that you need. But absolutely, it's a major priority.
Thank you very much. So we've had Senator Harckham join. Senator Brooke. Hi, Senator Brooke. So the two of you have just joined, and I just wanted to, we've been just chatting with Commissioner Sullivan in the meantime. Thank you so much, Senators, for joining us for our town hall. As you know, Families Together represents families of kids with cross-systems needs, including both mental health and addiction. We have lots of lived experience, either raising a child or a youth themselves with lived experience who are part of our program Youth Power at Families Together. And we really, our role in part is to provide access to families and young people to have a voice in policies. We have this saying, nothing about us without us, right? And so don't make policies about us without us. Give us the opportunity to give feedback and input so that you guys can create laws and regulations and stuff that will have better outcomes because we've had the input as stakeholders. And with that, we've assembled a panel of experts, family members and young people themselves with lived experience, who are here to ask questions of those of you in Albany who represent them. And we're thrilled to have the opportunity to have Senator Harckham, who's the chair of the Senate Alcohol and Substance Abuse Committee, and who's been doing a fantastic job with that. Thank you very much. And especially with the combining of OASIS and OMH into a unified agency, which families have been saying for many, many years we would prefer, because it means coordination and collaboration instead of us having to learn the cultures and acronyms and everything else of two different systems that have different regulations and different authorities, and never coordinate, not very often coordinating. We used to joke that, you know, families often are the care managers for the care managers, you know. So we're thrilled about the opportunity to, and we want to have meaningful input into the planning of that merge. So we're happy to have you, Senator Harckham, and happy that you consider us important enough to take time. I know that you guys both have session going on right now, and that we feel grateful that you could take time for us.
Well, thanks for having us, and thank you for all you do. You know, you are the ones who guide what we do through your experience, helps us set better policies. So thank you.
Thanks. And Senator Brooke is from Rochester and is new to as chair of the Mental Health Committee. And we couldn't be more thrilled to have you. You know, sometimes when we meet with, especially someone who's just been appointed to a new committee, to one of our committees, we end up spending much of the session, the legislative session, educating them about our issues, teaching them the language, teaching them sort of what's happening that that they need to know about so they can help shape policies, right? Well, Senator Brooke has come in with hitting the ground running, knowing the information, very well informed about all of our issues, and an ally, a real ally for us in the Senate, and just couldn't be happier to have you there to represent us, and also appreciate your attendance here today. It demonstrates how much you care about our voice.
Thanks, Paige. And you said it so well. It's not for the record that I had all this knowledge banked away waiting to become chair of this committee, but rather that our team really prioritized meeting with families and people affected, and going into the communities to try to better understand. So there's still a lot for me to learn, but I am certainly excited to be here and to hear more so that we can figure out how better we can support.
Thank you, senators. So it's my pleasure to introduce Tiara Springer-Love. Tiara is the director of Youth Power, which I mentioned earlier is a part of Families Together in New York State, and is youth-led and youth-run. And Tiara, I'm just going to let you introduce yourself and talk about yourself, and then you're going to run the panel.
So good afternoon, everyone. As Paige stated, my name is Tiara Springer-Love, and I am the Director of Youth Power over here at Families Together. I am also a young adult who lives with a mental illness and has been impacted directly and indirectly by both the OMH and OASIS systems. So today we have a great panel lined up, and the first question is going to be to Senator Brooke from Daphne Brown. And Daphne, I would like for you to introduce yourself and shortly, and then just like dive right into your question, okay?
Thank you, Tia. Hi, Senator Brooke. I'm Daphne Brown. Can you guys hear me? Yeah. I'm Daphne Brown. I live in Rochester, New York. I'm the Director of Family Involvement for Families Together in New York. I have been with Families Together for 14 years. And they have taught me a lot about advocating for my own children that have had behavioral health issues. Recently in Rochester, in our community, we had a young girl whose family was in crisis, and the police were called. And the thing that I'm a parent that has called the police, except that I didn't get that response that this young woman, this family got. And my question to you is there a way that we can equip families with the information and resources that they need when they're in crisis? Because we know that, we've all been taught that police are our first responders, and that's fine in some cases, But in cases where families need a little bit more and where children are not committing crimes, is there a way we can equip our community to call the right people to deal with the issues that face our community? You know, not only did that happen to that young woman, but we've had several incidences in Rochester that have just really shocked our community, and we are not happy because, you know, people go through things. Not everyone is a criminal, and we need to give people what they need, not just what we have. So that's my first question to you.
Thank you, Daphne. And thank you for coming to represent Rochester. I love being able to go to a room and see some of my hometown folks. So I'm so happy to be here with you and everyone else today. And you basically described probably my first 2 months in office of what I have been thinking about, possibly more than I've thought about anything else. So I want to share with you to understand where I'm coming from. When I asked to be the chair of the mental health committee, I knew that having me, right, who I am, where I come from, what I've done, my lived experience, including being a Black woman born and raised in the city of Rochester. And for what it's worth, also, my mother has been a teacher for decades. She did special ed for much of my childhood. So I actually had a front row seat to a lot of the different emotional and traumas that a lot of our young people have, and how I saw how a caring, supportive adult can help support that, right? But in this position, some of the things that were most important to me were, one, prioritizing culturally competent care. So you talked about at the moment of crisis, right? How do we give parents more supports and resources? The truth is, we know there's a continuum of care where we need to support our families and our children before they get to those points. Of course, it might be inevitable that there will be moments of crisis and acute moments where we need help, but being able to have enough providers, have providers in schools, have providers available to help families and help their children who struggle with some of these mental health challenges or developmental disabilities or criminal justice involvement, right? There's more that we can do to support them. And so one of the priorities I have is being able to provide that care and making sure we have the providers we need. The second was truly making sure that those providers are in our schools and making sure that every child has that access, because we know that schools are much more than education, right? I think we all learned that in the middle of COVID-19. It's where you get your food. Sometimes the only nurse or doctor you see is the nurse that you see in school. It's where you can get mental health help. And we have to make sure we're making that investment. And the third one is kind of, I think, to the core of what you just asked about, is what are we doing in those moments of crisis? When a family or a parent or a guardian is struggling, needs someone else to come in. They cannot handle and resolve this issue on their own. They have to have someone to call who does not think that pepper spray, handcuffs, a baton, or a gun are the first lines of response. So we have to be able to find someone outside of law enforcement and what law enforcement has been trained to do to be there. You talked about that 9-year-old girl, but we're here in Rochester. That wasn't the first time that happened, as you said. That's the one that got national attention. That's the one that the BBC of all institutions called me to talk about. But this happened earlier, just months earlier, to another young kid who was handcuffed. Mm-hmm. And I think that it is because this system has removed the humanity and the humanity and the childhood from these children, right? They look at them as adults. They look at them as though they should be more responsible. We're talking about 9-year-old, 10-year-old kids. These are children. What did I know at 10 years old, right? These are kids. And so we have to look at it like that. And when we think about at 9 years old, you're in 3rd grade, 4th grade, what's going through your head? What kind of things would have helped you feel better in that moment? Maybe someone telling you it's okay. Maybe someone asking you what you need. Maybe someone comforting you as opposed to attacking you and pushing you to the ground and handcuffing you and pepper spraying you. We will deal with the trauma from that young girl and so many other kids for decades. That trauma doesn't go away. And so that's why I did introduce a bill to at least make pepper spraying a 9-year-old girl or any minor illegal. because the scariest part was that law enforcement was following policy. They were following procedure with that. And so that tells me procedure's broken. But the second thing that I think is really going to help with this is Daniel's Law. And Daniel's Law, in the name of Daniel Prude, who lost his life in a similar situation of being in a mental health and substance abuse crisis and not having the supports they need, folks called the police because, like you said, Daphne, they just needed help. They didn't know who else to call. And so what Daniel's Law does is it creates statewide and regional councils that implement these mental health response units. And that is who we train dispatchers to send when someone is having that kind of crisis. That is a counselor, a therapist, a social worker who is trained in culturally competent and crisis management, where they can de-escalate, support, and get that person to the next point of care that they need. I think that's the change that we need. I think we need to completely rethink how we are treating people, especially Black and brown people, especially our children, and making sure that we come at it from a point of compassion and not punishment.
Thank you.
Thank you. So the next panelist that we have going up right now is Barbara.
Good afternoon, Commissioner Sullivan, Senator Brouk, Senator Harckham. My name is Barbara Callahan, and Paige just said that we are experienced and we have lived this lived experience. I didn't ask for this experience. It's not an experience I wanted to have. It's not something I wanted to do today. Today, I want you to be outside doing something fun, but I'm here talking about something that's really close to my heart. So I'm the parent of a son who passed away. And it's really, really difficult for me to stand here and tell you about that. I feel like crying right now, right? So it's really difficult, but it's really important for me to talk about it as well, because it's so pertinent to what we're going to be talking about right now. So my question is in regards to the integration of OMH and OASIS. And will the new OAMH be integrating services as well as administratively activities? The lack of integrated services for the last many, many years is part of the problem, right? So my question is, will, as a community member, if I go to an RTF, to a CR, to a hospital, will I see integrated services? Will some of the things that we have been exposed to, things like the locator document, which sort of says, here you go, here for your mental health before you come here for your substance abuse, or vice versa, right? Those are things, those are details of the system that separate us and don't give us those co-occurring disorder treatment that we need. So I know you spoke about it a little bit, Dr. Sullivan, but I think even digging down a little bit more in being able to go to a clinic where people are, where the staff are, well versed in co-occurring disorders, and it's not this separate roadmaps for each one. I leave that open to speak about.
And Senator Harckham, you can tackle this one, or Commissioner Sullivan if you'd like to. So either or.
Senator Harckham, why don't you go first, Senator, and then
why don't we both tackle it?
Okay.
All right. It's good to be here with the Commissioner and Senator Brooke, who's a great partner. Barbara, I'm sorry for your loss, and thank you for your courage. I've been in recovery a long time, so I've lived a lot of this. I started using when I was an early teen, and I understand a little bit about the challenges our young people face because of my own experience. And you are so right. We need to address co-occurring disorders. That is why people are self-medicating. That's why people are relapsing, because we're not dealing with the co-occurring disorder. And that's one of the reasons why I think this merger will be so helpful. There's some other reasons as far as like billing and funding streams and things like that. But our mentality, as Senator Brooke was saying, how we have to change certain systems. This is one of them. We have to look at people holistically, and you don't get your physical health care here, your emotional health care here, your substance use disorder care here. We're one person, and we need to do it holistically. And I know the commissioner and the OASIS commissioner get that. They're committed to that. This has been a long time in coming. But one of the things that's critical, and we're going to be attaching some budget language, is it's so critical that we have a council of stakeholders, including families, as to what is the best way to navigate this from the user perspective. So, we in government, we look at systems and policies and stuff, but you and your loved ones are the ones who have to navigate. And what we need to do is create a patient-centered system that's friendly to you and your families. So I think this is the way to go, absolutely. But it's going to take a little time, and we want to, the old saying, measure twice, cut once. We want to be sure we get it right. And lining up the org chart and the budget columns, that's the easy part. How do we address the soul, the emotion, the brain, and the body? That's the part that's going to take time, and that's where we need to bring you to the table.
Yeah, and I just agree with what Senator is saying, and thank you, Barbara, for being here today. If we don't do the right thing and make sure that the integrated care really happens at the front door, at the point where the person walks in and needs help, then the whole thing wasn't worth it. And then I agree, there's no real need to administratively do all that kind of stuff. It's got to be focused on the whole person. And I'm telling you, this is not easy. I've talked to other commissioners who combined state agencies, and some of them haven't gotten it even close to that. Others have gotten closer. But sadly, we have been these siloed, from the time we train people to the time we develop our services, we've been these siloed entities, which is not the right thing for individuals who come to us for help. So I think we're going to work really hard at it. And as the Senator said, we've got to have your input. You can't, what is it? Don't do anything about us without us. We're taking that very much to heart. I mean, we have to. If you don't, we'll miss the mark. We'll just miss the mark. We'll design something that won't really get what we need. So we'll be working with you. We'll be putting it together, and we're going to learn along the way, because I've tried to see if there are magic bullets somewhere that we could find some place that did this, and it doesn't exist. So to some extent, we can learn pieces from places, but we're going to have to do a lot of the work ourselves, and we desperately need you to be there with us doing it.
Thank you. Thank you.
Thank you. Our next panelist is Christina. So Christina, if you could just introduce yourself shortly, briefly, and then head right into your question.
Sure, thank you, Tiara. So my name is Christina Halman. I work as a family peer advocate out here on Long Island. As a parent, I'm struggling with my son. He's had multiple hospitalizations, multiple suicide attempts, and he's in a constant state of crisis. On paper, our region has home and community-based services that are meant to prevent the escalation into these higher levels of care. But honestly, in my reality, these services might as well not exist. My son sits on wait lists for months at a time. During his wait, he winds up hospitalized again before he can get the help he needs. Meanwhile, our residential treatment facilities are downsizing or closing. We need investments, not cuts. As I sit here right now, it's actually very hard, I'm not gonna lie, because I'm afraid that my child's not gonna live to see these changes made. So my question to you is, how much longer do our families have to wait before these services are fully implemented?
Well, you shouldn't be waiting. I'm really sorry for that. And I think that, we're working very hard, but you're right. There have been stumbling blocks in putting, especially some of the family-based home and community-based services in place the way we wanted to. And the CFTSS is growing. There are problems still with the waiver services, with the HCBS waiver, which I think is probably what you're talking about. And you're right, the waiting lists on that for a variety of bureaucratic reasons, which are truthfully indefensible, have been stymieing families from getting what they need right away. So we're working very hard to move that along. Sadly, when new services like this come up, this kind of happens, and I'm not excusing it. I'm not excusing it, but we're working very hard. And I would also, although I know you're just one of many families, but please feel free to contact me in my office about what's your particular, because what I found is that everybody has a particular, unfortunately with bureaucracies, everybody can have a particular stumbling block that kind of can slow things down. So please let me, please contact me in my office. We'll see what we can do. But you're right that there's an issue, and we're working very hard to get those dates better. The services themselves, I think, are valuable, and I think will be good. They are not out there in as easy a way to access yet. And there's also, for some agencies in some parts of the state, places where it's even workforce shortages still in getting them up and started. But you're right. Let me just say about the residential downsizing. The residential beds in terms of RTFs, for example, have been declining across the state with no effort by anybody's part for quite a while. What we want to do is still keep some residential beds. We want to upgrade some of the services that are provided in our CRs, which are a different classification, and then build what I was talking about earlier, which are things like ACT teams and mobile teams that will go out and work with families. So it's not the transition from some of those residential RTF beds to community services is in process. You're right, when you're doing it, it can be a stumbling block, but we're working on that, and those dollars will not be lost. Let me just say that. They're not going to be lost to the system. They're going to be transformed. And again, we need your help with it. But I'm sorry about the issues with your son, and please contact me and let me know.
Thank you. I will definitely. Thank you so much, Commissioner.
Christina, I just want to talk about, you made an excellent point that we need to be investing, and the state for the last several years has been holding flat or disinvesting. And so we need to, and I know there's a commitment in the legislature to do this, things like opioid settlement funds, we must dedicate to put into treatment. Things like a portion of tax revenue from legalization of marijuana. If you look at Senator Krueger and Assemblywoman Crystal Peoples-Stokes' bill, 25% goes into treatment, prevention, education funding. So things like that, we need to dedicate funding streams. We are also very committed to raising revenue so we have more money to invest in programs like this. So you're right. It's two things. There's, the systemic policy side, but are we as a state committing enough resources? And I think that conversation is changing, and certainly both the Senate and the Assembly are committed in this budget to try and find additional resources to make those critical investments so that the commissioner can do the work that she does.
Senator, and this is Brad Hansen. I'm the Public Policy Director of Families Together. And I also want to add to some of the revenue that you're talking about. We also have increases to the mental health block grant, the substance use block grant that was increased as part of the federal COVID relief package the end of last year. And so these things also, as you've been saying, can also help get those services jump started online sooner for families like Christina. I really appreciate you bringing that point up.
Thank you. I know we're short for time, but I wanted to know if we can get to the young person's question. Do we have like 5 more minutes just for one more question? Okay, great. So Chance apologized that he had to log off. However, he and I spoke prior to him coming onto the panel, and he and I actually kind of like bonded over this, which is very interesting because he's in the central region and I'm all the way down in New York City. And this was something that we were able to say, this is what rural communities and the city community both have in common. And it's in regards to the school system and support. So my personal experience was I went to Forest Hills High School, a school of 4,000 students, and there was one school psychologist. There were many students who were either utilizing substances or having mental health breakdowns, and there were not enough supports. So to his question, students spend a large portion of their life in school, so that is a great place to engage them and provide mental health substance use services. What is the state doing to expand additional behavioral health services, including peer support and prevention in schools?
I can jump in and, oh, is that an echo just for me or is that bothering you all? Oh, you're good. Okay, then that's okay. I can work through it. Well, first of all, I'm sorry we didn't get a chance to actually have our young person here with us, but thank you for at least bringing his question to us. And I want to share with you all that, you know, this is something that has been really heavy on my mind of how we're supporting students and getting them the help they need, like where they already are. And just last night, we actually had a 2-hour town hall all about the mental health needs of students. And I am still kind of, I not want to say appalled, but I was really disappointed and honestly saddened to hear so many stories just like the one that we just heard, of young people who feel like they do not have the support that they need, who feel like they don't have someone they can go talk to, when you're supposed to be able to trust, you know, your teachers and school staff, but there are not the people equipped with how to handle these kinds of scenarios to help our young folks. I do want to add on to what Senator Harckham mentioned a little bit, but we are looking at lots of cuts to these kinds of programs. And if we cannot raise more money as a state and raise revenue, we keep seeing these cuts. And so one of my top priorities for young students like this is that we raise the revenue that we need as a state to continue to make these investments, because every year we have been making fewer and fewer investments. And as we see, the needs get greater and greater. And I can't imagine what students have been through this year with COVID-19 and the isolation, not being in their social networks, getting ripped out of their routine, having stressors at home with parents trying to keep up with career and also take care of their children, younger children perhaps, and also try to be a teacher at the same time. It's been nearly impossible. And so, so at least from our part, one thing that I'm very focused on, I know a lot of folks are really focused on, are making sure that we can raise the money to actually institute these kinds of programs and make sure that these providers are getting into our schools to actually be there for our students.
Yeah, thank you so much, Senator Brooke. I just wanted to add that there are a couple of things that we're doing. I'd mentioned them before, but just to say one more time that there is this $10 million in the budget that is for schools and mental health agencies in the communities to connect and to become available, the kind of thing you're talking about, that they share the burden of what's going on in the schools, and that the mental health agencies move in and be a part of that. And that's what that $10 million is there to do across the state to school districts that are in high need. And that will help them to make those bridges. I think as a part of that, we are constantly working, as I said before, to set up school-based clinical services in the schools. And we have almost, over 900 now. We continue to work with the schools. And the exciting part of this is there's been much more interest on the part of the schools in the last few years. I can honestly say they're now coming to us and saying, help us do this. So I think that that's something that we're doing. And then third, we did manage to get a large FEMA grant from the federal government because of COVID-19. And a big piece of that FEMA grant is working with the schools and providing a combination of crisis counseling, screening, teaching, advising parents as to what to look for with problems kids might be having coming back to school when schools get more integrated. So there is that FEMA work is going on now with the schools. And so there's a lot of work. So it's not enough. It's not enough. We still don't have it. You should have a clinic, my book, in especially every high school and middle school, and probably also elementary schools, but at least high schools and middle schools. But we're working on that. But I do think that the FEMA grant will also help us do a kind of pretty wide outreach at this point in time into the schools and do some crisis counseling and work with families and youth that I think are going to be responding to the pandemic.
Thank you. And then I just wanted to just say on his part, he did want to stress the need for peer support, right? And not just clinicians, but ensuring that we have peers to support us. So thank you all so much. You guys are wonderful. I really enjoyed hosting this town hall with you all, and I'll pass it over to Paige and Brad.
Thank you, Tiara, and thank you very much. First of all, to the ambassadors, the panelists who were brave enough to share their stories, which were very personal and I think they illustrate the point so well. And this is the point of having this kind of forum. And I joked with Brad yesterday that we should do this every year, regardless of the pandemic. This is a way for legislators, commissioners, and families and young people to all hear from each other in a, and there are hundreds of people that are watching this right now, and it's being recorded and it's live on Facebook and will be available on our website. But I just am so encouraged when we have these, because what I'm seeing, and this has not always been the case. I've been at Families Together for 21 years, and we don't always have such strong allies in the legislature and in the state agencies as we have right now. And I'm so encouraged by that, because with these kinds of partnerships, we can get so much accomplished. And these are tough times. These are very tough times, and we need the kind of leadership that we're seeing demonstrated here today. And we just couldn't be more grateful for your partnership and for your attention to our issues, and for just appreciating what these families and young people have to say. And we have some written questions that were entered into the chat that we're going to send to you, in case, if you have time, can get back to us with any other questions or answers, I should say. That would be fantastic. We'd love to hear more from you.
Absolutely. Send them our way. We're happy to get back to you, and think of this as the beginning of a longer dialogue, not just an annual thing. We're always here for you, and let's do this regularly.
Thank you so much.
Take care, everybody.
Thanks. Bye-bye.